testimony of the Minority Leader.
Thank you, Mr. Speaker. We are clearly in a technical revolution in our country. People now have more information available to them than really any other time in probably the history of our country. They know more about what's going on in their government than they ever have before. And I think that's one of the reasons we're seeing people all across America rise up and start making such bold statements as attending these tea parties and attending these the members that are having meetings in their districts, and they're coming in record numbers. Back this August, I had an opportunity to have a number of town hall meetings in my district, and thousands of people came to voice their opposition to what they think is happening to their country, and particularly in opposition to this health care bill. Every morning, Americans wake up and follow with deep interest public policy issues that we were sent here to solve, and many people watch C-SPAN. I know that when I'm back in the district, many people will say, "Congressman, I saw you on C-SPAN." In fact, recently I had a conversation with one of my constituents that lives over in Muleshoe, Texas, and she was calling to express her great concern about what's going on to her country, these huge deficits, that trillions of dollars of spending money that we don't have, the government taking over the health care, and she was concerned about what's going on. And you know what, as I learned, is she spoke more and more. She knew a lot about the issues that were facing her country, and she said she picked up a lot of that by watching C-SPAN. So a lot of the viewers that call into C-SPAN on a daily basis, they'll voice their disappointment or concerns about what's going on in the country, and they'll say, "And thank God for C-SPAN." C-SPAN is kind of the watchdog, the eyes, the ears, the vehicle that enables millions of Americans to see what we're up to here in Washington, D.C. Every day, the people can view Congress raising their taxes, decreasing their freedoms, forcing business owners to pay more fines. All of this, thanks to C-SPAN, is here for millions of Americans to see. Except that's not going to be the case for health care reform in our country. Mr. Speaker, it's no secret that the majority plans to negotiate the final 1,000-page health care bill without C-SPAN cameras present. President Obama promised when he was running for president that he was going to change Washington. He vowed at least 8 times that the American people would get to see the negotiations of the health care bill on C-SPAN. But Speaker Pelosi promised that the Democratic-led Congress would be the most transparent Congress in history. She went on to say that the work on the health care bill being displayed historic transparency while simultaneously, unapologetically denying C-SPAN cameras access to capture the ongoing negotiations. In fact, those negotiations have been going on somewhere in this building. None of us, very few of us know where, and very few people are in the room making decisions that are going to impact the American people, not for this generation, but generations to come. And all of this talk about transparency and openness, yet nobody knows who's actually in the room and actually what's happening. But we do know what happened when they went into the room, for example, in the Senate and other places, the deals were cut. And I think one of the problems that this majority has and this White House has is they've got a health care bill that's so unpopular that they have to meet in secret to talk about it, and so that they can cut deals so they can get enough votes to pass it. Wouldn't it be nice if the American people could experience some of that transparency that the Speaker and the President of the United States promised the American people, that they could be able to see the negotiations? I had the opportunity to experience what is positive about having these negotiations in a public setting when we did the Farm Bill a couple of years ago. We sat down at a table. We had Republicans and we had Democrats. The cameras were on. The discussions were frank. They were honest. They were open. And in the end, you know, democracy took its place, and a bill was crafted, and it was passed by the House and the Senate. I don't understand why we can't have that same transparency and openness when we're talking about people's health care. Probably one of the most important things to many Americans is the ability for them to have some control over their health care. We have now a bill that's talking about taking over the government, letting government take over the health care of our country, and yet we're negotiating and debating this bill in the darkness of some room somewhere in the Capitol and who knows where. Let's turn the lights on to this debate. Let's turn the lights on in that room. Let's turn the lights on so that the American people can see what is going on as these new decisions are being made about their health care. It's too important. Now, the Democrats are going to say, yeah, but when the Republicans were in charge, that's the way they did things. Well, that sounds like a kind of a schoolyard taunting contest, but the fact is that's not the truth. The truth is, and I want you to remember these dates, July 15th, 2003, September 9th, 2003, November 20th, 2003. And you say, well, what happened then? Well, one of the good things about C-SPAN is they have a great library of American policy and democracy in action. In fact, it's probably one of the most extensive ones in the world. And people can come and research and kind of see actually what did happen on the floor of the House on a particular day. And what happened on that day was that members of Congress met to resolve their differences between the House and the Senate version of the Medicare reform legislation that provided prescription drug benefits for Medicare recipients. A very important piece of legislation, one that was not without some controversy. The House passed a version, the Senate passed a version, and then in the light of day, these two versions were negotiated on these days. The American people got to see the discussions that went on and got to see this bill being crafted that eventually became law. If the Democrats weren't engaging in these backroom deal-making deals, I think they wouldn't mind the lights being turned on. But the problem is they're cutting deals. And the reason they're having to cut deals is because they're trying to pass a piece of legislation that the American people don't embrace. Many of us agree that health care needs to be reformed. And my colleagues on my side of the aisle, Republicans and conservatives, have been offering some common sense ideas that could reform the current system without turning over the health care to the government, without limiting patients' rights, and bringing more transparency and making more health care more affordable and available and accessible to the American people. If the President and the Speaker and the congressional leaders are serious about this new era of openness and transparency, then why, Mr. Speaker, why, Mr. President, why aren't the lights on and why aren't the cameras in the room so that the American people can see what's going on in their country? I believe they deserve to know. This is a very important issue to the American people, and I hope that the Speaker and the President of the United States will keep their word and allow the lights to be turned on in this important issue. It's now my pleasure to recognize the gentleman from Pennsylvania, Mr. Thompson.
Well, I thank my